The government has signalled a series of measures which it's considering to relax the lockdown while minimising the risk of coronavirus spreading. An announcement is due a week today, which will set out the next steps to getting the country back to school and to work. 315 more people have died from coronavirus in the latest 24-hour period. That is a figure which could still go up because of a lag in reporting. The total number reflects those who've died in hospital, in a care home or in the community after testing positive for the disease. It brings the total number of deaths in the UK to 28,446. Our political correspondent Chris Mason has more.
A portrait of the UK in lockdown. For well over a month, streets have been quiet, most shops have been closed. A pause button pressed on normal life. But if imposing these restrictions felt like a massive moment, easing them could prove much, much more fraught. At this afternoon's government news briefing, one of the Prime Minister's most senior colleagues told me local lockdowns might have to be reimposed.
Our phased approach is one which allows us to monitor the impact that those changes are having on public health, and if necessary, in a specific and localised way. That means that we can pause or even reintroduce those restrictions that might be required in order to deal with localised outbreaks.
Trains won't look like this again for some time, but if we're to return to work, they won't be able to look like this either.
So I'm looking at the train, working with the train companies, unions and the rest of them, all of the above, and there are a series of different things that we can do, including, for example, staggering work times, working with business and organisations to do that.
There's a similar challenge in schools. Empty or near empty classrooms in lockdown, and now tentative plans being sketched for them reopening. Wales's First Minister said today it would take 3 weeks to get schools back open from the moment the decision to do so was taken.
If we bring particular age groups back in first, that will allow us to spread them out through the school as a whole, enabling us to observe social distancing and therefore giving confidence to parents and teachers.
Mr Drakeford said it'll be a decision for his government as to when this happens. Scotland's First Minister Nicola Sturgeon said the same today too. But take a look at this. This was Leeds this afternoon. Getting the country going again could involve more than just changing the rules. It's likely to require persuasion too. We've got very used to the mantra plastered across the lecterns you're stood behind. Can we expect a more subtle message to come in the next phase to mirror what could be a more subtle, a more nuanced set of rules?
What we need to do, I think, is just to make sure that the on-the-ground advice that we give is sufficiently reassuring. I think it's about making sure that people feel that the pointers that we're giving about how a workplace can be safe are sensible, reliable, supported by employers and trade unions.
Getting back from this to normality is going to be a long and difficult slog. The government is promising to set out the next steps next Sunday. Chris Mason, BBC News.
Well, easing the lockdown will require striking a balance between a gradual resumption of normal life and keeping the virus at bay. Our science editor David Shookman examines now what scientists will be looking for as the restrictions are relaxed.
1, 2, 3. Across the UK, the numbers needing hospital treatment are generally falling. That's a key indicator that the spread of the disease is slowing down, that the restrictions have made a difference, but the virus has not gone away. The latest estimate of the infection rate, the so-called R number, is 0.7. What matters is that it's below the threshold of 1, where one person infected only passes the virus to one other. Now, reopening schools might add something like 0.2, so we could still stay below the critical line. But lifting the lockdown entirely could add 2 to the R number, which would see the outbreak accelerate once more. So scientists are warning that there isn't much opportunity to relax any of the measures. Singapore has rushed to install 4,000 new hospital beds because infections, which were thought to be under control, suddenly started to rise.
What we're seeing in countries like Singapore, where they've seen almost like a second wave, essentially what it is actually outbreaks that are happening in expat dormitories. And so the virus has found a place where it can take hold and it can resurge again. So all countries must remain on alert for the possibility of additional transmission.
Whenever measures do come to be relaxed, testing will be crucial on a bigger scale than now to track the virus and spot any new outbreaks. With that comes the job of tracing all the contacts of anyone infected. 18,000 people are being recruited to do this, but the system is not yet up and running. And vital to all this is isolating people who are infected or think they may be. This whole process is going to be needed for months to come. However the next steps unfold, they'll take us into what could be a more complicated phase of the crisis. That's because the lockdown currently affects pretty well everybody the same way. But once you start relaxing measures, some people will be at home while others are out and about, which could be confusing and probably harder for the government to explain.
Different people will be doing different things differently. And I think that can undermine both solidarity but also trust and possibly adherence, and could engender a degree of resentment.
And all the time there's the challenge of keeping people safe.